You can start, sir.
Okay. So hi everyone and welcome again to this another session on anatomy. I'm Dr. Ankit, your anatomy faculty at Auricle, and today we are going to discuss another important topic from the upper limb, and that is quite an important topic, as you might be knowing, the region of axilla and the much awaited the brachial plexus over here, right? Okay, so these sort of sessions are going to be benefiting both the university going students as well as the MCQ preparing, that is the next or the NEET 8 PG exam or those. Okay, let us see some of the questions that can be asked or that have been asked previously from these topics. And from these topics, you can take the screenshot of this, and these are some long essay questions, some short essay and short answer type questions. Let me read out a couple of questions. Like a long essay question can come about describe the formation and branches and clinical significance of brachial plexus. Brachial plexus, a highly important topic. Then short answer question can become like, what are the root value of the brachial plexus? Name the branches of axillary artery that comes under the topic of axilla, and which nerves primarily are involved for the problem like the obstruction. So these sort of questions can come, right? Likewise, here's short essay. So guys, why to choose Auricle? So many things are over here, and actually all the things are covered academically. If you want to progress career-wise, profession-wise in medical field, then an online platform like Oracle is a must-have because you will see subsequently see the important parts. See recorded classes, live classes, they are the backbones which all the platforms are providing. What is unique about Oracle is that we have the practical sessions as well as apart from the recorded live classes, we have the express exam module and a very beautifully crafted hard copy book set. So practical sessions and hard copy book set are something which you should be looking for. These are something which are extra. And not just these two, but the other features are as well, which I will subsequently show you. So these are the recorded classes, then we have the live classes, then we have the express exam, or you can see the quick module over here. Yeah, one-to-one doubt clearing session is something which you have to look out for. A one-to-one doubt clearing session, right? So I hope the word itself is explaining how important it is and how beneficial it can be for you. Then all as discussed, hard copy notes and question bank, and these some of the practical sessions are over here. Coming to the subscription plans, now we have different subscription plans ranging from right from the 3 month period to 6 months to 12 months and around 4 years. And these are all the packages you can see, and these are all the features which you will get. Now you take any plan from the beginning itself, you get the recorded live classes, express exam module, practical sessions, and QBank. They are in every subscription. But as your subscription goes for 1 year or more than 1 year, that is around 3-4 years, you get a hard copy note set as well, plus one-to-one doubt. For the more time you are with us, doubts will obviously come and that can be sorted out. Regarding this payment and all, you can use the code below, Dr. Ankit 20, just get it on the bottom line, and for you can get some discounts also on subscription. Okay. Okay, let's move on and let me show you the poll feature also over here. So here we can see the poll feature, and yeah, let us launch a poll and poll according to the session today. So we can start a poll over here, and the question, as you can see over here, and you can also attend the poll. I'll read out the question for you, and then you can answer it as well. So first question is, which spinal nerve roots contribute to the brachial plexus? Now these are these are the topics that we are going to cover in our session, but yeah, we can call it as a pre-session questionnaire. So you have this question number 1 over here that just a second, which spinal nerve roots contribute to the brachial plexus? Your options are option number A, that is C3 to C7, option number B, C5 to T1, option number C is C4 to C8, and option number D is C6 to T2. These are the options. Let's see. Let me wait for another few seconds. Okay. So the answer for this is, I'm running the poll right now in 1 minute time, a couple of more seconds. Well, okay, answer for this is our obviously C5 to T1, C5 to T1, that is a root value of the brachial plexus. Okay, so answer will be option number B over here, option B. Let us do one more question. Here's one more question. The brachial plexus, that is question number 2. The brachial plexus is divided into which 5 regions? Okay, so brachial plexus when we study is actually divided into few regions. Options are, first option is root trunk division cord branches. Let me just share the results so that we can Okay. Okay. Yeah. So options are: option number A is root, trunk, division, cord, and branches. Option number B is root, trunk, cord, branches, and fibers. Option number C is root, trunk, branches, division, cords. And option number D is root, branches, cords, fibers, and trunks. These are the few options. Take your time. You can answer in the poll. Let me just check everything is working fine. So, brachial plexus divided into which 5 regions is the question. Take a few more seconds. Okay. Fair enough. So we'll discuss them subsequently in our discussion also. That we have roots, then we have trunks, then there are divisions, then there are cords and there are branches. So correct answer will be option number A. Okay. Subsequently, we'll move forward and look at other questions as well. So let's move back and come to the topic straight away, and then we will come back to this poll part and we'll discuss the other polls as well. Okay, let's start with the topic. So topic is already discussed. The topics are our axilla and the brachial plexus. Okay, just a second. Right. Okay. So we have the topic of axilla and brachial plexus. We'll start with the axilla and then we will come into the brachial plexus. But before discussing into the notes aspect, I just wanted to brief you some important basic concepts and obviously come to the notes part. So today there are two topics. First topic is axilla and the second topic, as we discussed, is the brachial plexus. So some basic concepts about the topic axilla. So what about the axilla over here? See, if you look at the human body, then we have the head part over here and the neck over here, and then we have this shoulder part and this upper limb, and this is this trunk part and the shoulder, upper limb, the trunk part, and the abdomen comes and the lower limb and all that comes, right? Now what happens is that in this lower part, in this trunk part, what we already know is that we have a area over here that is the rib cage. So we have the ribs over here, I guess we all know. And inside the ribs, we have the thoracic cavity. So this part is the thorax. Just hypothetically understand. And where the upper limbs are coming out, obviously, these are the area for the upper limb. Now, upper limb, as we all know, is doing all the function. There's movement and all muscle movement and arm movement and sensory area, all that is present in the upper limb. So for all these movements, there are nerves which will be needed to supply the muscle. Then the nutrition is needed that will be provided by the blood supply. So what actually happens is that the nerves are obviously coming from the spinal cord. So we have the spinal cord. Just imagine the spinal cord over here inside the vertebra. So the nerves will come from here on both the sides and they have to reach the upper limb. Now, as the nerves will come from here and reach the upper limb, they have to pass through an area, right? And this area between the upper limb and the neck or the thorax, this region over here, this region is our axillary. Likewise, we have the nerves, we also have the blood supply. So there will be arteries from here. This is imagine the heart being located over here. This is imagine the heart. It will give out the aorta. From aorta, the arteries will come out. And from these arteries have to reach the upper limb. Again, they have to pass through this area. Again, this area is the axilla. Okay, now if you look at the video, then this area, this armpit area, this area, if I put my complete hand over the front of my right shoulder, my left hand over here, this whole area, which is actually outside the rib cage, this actually is our axillary region on the right side and also on the left side, the right and left side. I hope this point is clear. So first of all, understand that what is axilla and why it is not under the thorax part, because it is outside the thoracic cavity. Like in the previous session, we discussed the topic. What was the name of the topic? The previous session, as we discussed the pectoral region. If you guys remember, if not, then would highly advise you to go and check out the previous session. So that was a pectoral region. Now this is axilla. It is not, axilla is not in front, but it is on the side. It provides a pathway for the nerves and the vessels to pass to the upper limb and coming back from here. Now, what do we mean coming back? as the artery is going, obviously, we all are aware that the veins will come back. So again, the veins have to come back through axilla. When the nerves are going, the motor nerves are going, the sensory nerve have to come back through axilla. Not just these nerves and vessels. What else can be there in the axilla if you can think of it? Let me put some images over here. Now there is a relation with the mammary gland that we discussed previous session, lymph nodes. Okay, so now coming back to the topic over axilla over here. So axilla is actually a passage. In simpler terms, I'm telling you, it's a passage that which it's a passage which provides access to what upper limb. A passage for what? There's a passage for what? Passage for nerves. Understand? Upper limb, sensory supply, motor supply. For blood vessels, arteries, veins. For lymphatics, including the lymph nodes. Right? Because again, upper limb also has lymph nodes. It has lymphatics. So lymphatics have to reach over here. So again, they have to pass through axilla. So basically, axilla is an area or a passageway which is giving passage to these structures, mainly nerves, vessels, and lymphatics. And apart from all of this, what else we have? We have obviously the various forms of connective tissue, various forms of connective tissue. So try to keep this in mind. What is axilla? What region axilla is, and what actually it provides. So let me highlight it. This region over here, similar over here. This region over here. This region is the axillary region present mainly on the sides. I have the point is clear. Okay, this thing try to understand. Now coming back to more anatomically perspective, more anatomical perspective will be what is the shape of the axilla? Then axilla, if we talk of its shape, now you understood it where roughly it is located and what for it is. Okay, what for it is, what is the function or what is the actual purpose of the area axilla. Now, what is the shape of the axilla? Axilla is shaped like a pyramid, not exactly, but it is like a pyramid. For example, if we look over here on the right side, then axilla will be somewhat like this. Somewhat it will be like this, having 3-4 different sides, having an anterior wall and a posterior wall. And if you look at the left side, then it will be somewhat, it will be like this. So these two are axilla on both the sides. They are not in front and they are not behind, but they're somewhat lateral. They're somewhat lateral, both in front and behind, you can say. Or the point, and in this region, there is a axilla is not a particular spot. It's an area, it's a region. Through this region, the blood vessels will pass, the nerves will pass, the lymphatics will be over here, and all that fibrofatty tissue, connective tissue, that all will be there. So it's quite a congested place, having a lot of stuff inside it. That region is axilla. And therefore, we will also, the next topic will be brachial plexus. What is brachial plexus? Nothing but it's a group of nerves that is going to supply the region related to upper limb. And where will that group of nerves be? It will be coming from the vertebral. I mean, from vertebral meaning by spinal cord inside the vertebrae, but they will be like the cords will be placed in the axilla. Because after the axilla, then the nerves will go to respective places, respective areas, respective muscles to supply. But in the axilla, they'll be in form of cords. We'll see later on, right? So as a topic axilla, what we're going to delve into is first of all, we will understand the various boundaries of axilla so that you have a rough picture, then you will have a definite picture. Because saying roughly this region is axilla doesn't serve a complete purpose. For complete knowledge, we should exactly know from where to where is axilla. Exact points. Then after understanding all the boundaries of axilla, then we will see what are the structures inside axilla. Like for example, we have already seen, but we'll delve a little bit detail into the artery of the axilla and obviously the nerves of the axilla. This is our motive of the present session. I hope the point is clear. Now we're going to delve into the details of the axilla as per our notes. Okay, so here we go. Okay, right over here. Yeah. Fair enough. So axilla over here. So the notes, why I prefer them, because obviously they're in a question answer format and it's easy for you to understand and also to transmit whatever knowledge I have to share with you, so we can add on to it. So like a question can come, write a short note on the boundaries of axilla. Okay. And first of all, anatomy, I always say, have a practice to make some diagrams. So first thing you can make is a simple diagram like this. Now, once you are beginning to read anatomy, obviously things become a bit complicated that, sir, okay, I'm looking at a diagram in the book, but I'm not able to understand exactly what it is. So for example, this diagram comes and you are surprised, okay, what they have made in the textbook. Try to understand this. This diagram. This diagram, what is the view of the diagram? Imagine I'm sitting on a chair and you are standing behind the chair and you're looking at the top of my say which shoulder, top of my left shoulder. So according to this diagram, you're standing behind me and you're looking at the top of my left shoulder. What you will see bony side is this head of humerus on the lateral side. This is the humerus over here, the bone over here. Then there's my anterior chest wall and a posterior area where I have the scapula bone. But anteriorly, there is anterior chest wall, that is the pectoral region. So which muscles will be there? Pectoral is major and behind it minor. Okay, so anterior is this. What is behind? Behind is scapula. And what are the muscles in front of scapula? So this over here, this is the bone scapula. Muscles in front of scapula basically subscapularis. Okay, it is subscapularis. We have written only let me correct, subscapularis. Then we have another muscles related to the scapula like latissimus dorsi, teres major, all these muscles, they are lying behind. On the medial aspect, which you are not able to see, but you can understand this area, right? On medially, I will be having my own left-sided rib cage. So here, I will be having the ribs over here, upper ribs over here. And between the ribs, we have the intercostal spaces where we have muscles. Like we have the serratus anterior and the whole thoracic wall. So serratus anterior, if you have heard or you have listened to previous lecture, and you will be able to recall that serratus anterior was coming from where? It was coming from the medial border of the scapula. So you can see this muscle over here. It is coming, this muscle, let me highlight it with the purple arrow. This is the serratus anterior muscle. So it is coming from the medial border of scapula over here. Can you see it? And then you can see it is going and inserting into which bones? Upper 8 ribs. So now again, keep standing over there, looking at the top of my left shoulder, humerus over here. Behind you have some muscles, anterior you have some muscles, and medially imagine that you have the rib cage where the muscles will come. Now this concavity, or if I just shrug my shoulders, you see a concavity. You can do it on yourself. When you shrug your shoulders, you have a concavity over here. That concavity, that area, that is the axilla. So where is the axilla exactly? This whole region which is filling over here inside, that is your axilla. That is the region. So you can imagine, okay, it is connecting the neck region or the central part of the body to the upper limb, this passageway. Is it inside the thorax? No, it is outside the thorax. And where would the thorax be? This is your thoracic cavity. This is our thoracic cavity, more medial to the ribs. It is inside the ribs. These are the ribs over inside it. And where is the upper limb? Upper limb that is actually moving all around. This is the region of upper limb. The region between them, that is the axilla. So in this, we can understand few things like the few walls that we can understand over here, like anterior wall or anterior border by P major, P minor. Posterior border, posterior wall by subscapularis and the muscles on posterior side. Medially, what we will have basically thoracic wall and the serratus anterior muscle. Now here, we can't include the entire thoracic cage because that will be huge. Because we have to reach the upper limb only, no? So here, when we say thoracic wall, we actually mean the region related to max upper 4 ribs only. Okay, below 4 ribs, that will be on the lateral chest wall. Okay, so it is related to upper 4 ribs only. So middle border is this. What lies laterally? Laterally over here. Now that is interesting. Laterally over here, we have an intertubercular sulcus. Now, what is that? Intertubercular sulcus, if you remember, I guess, it was second session of the osteology where we discussed the humerus. So this was, imagine the right humerus over here, head of the humerus. Okay. And then we have this whole humerus going down. Just imagine like this. And here we have the lesser tubercle. Let me write LT over here. And at the top and behind, we have the greater tubercle. And between these two tubercles, we had a groove over here that was known as intertubercular sulcus. So now, the lateral border of the axilla is being formed by the intertubercular. Now, how is that possible? That is one question. You might be thinking, how is that possible? It is possible due to this intertubercular sulcus muscle attachment. What is that? In the intertubercular sulcus, if you remember, there are 3 muscles which are attached. Now, let me zoom this intertubercular sulcus for you. let me zoom this intertubercle sulcus. So let us again try to make the head of the humerus. Okay, and this bone over here going down. And imagine this is the area of intertubercle sulcus, and let us zoom it. Let us zoom it. If we zoom it, we will see 1, 2, and 3 muscles attached onto the intertubercle sulcus. Which are these 3 muscles? Laterally on the lateral lip, we have the P major muscle. On the medial lip, we have the teres major muscle. And on the center, on the floor, we have the latissimus dorsi muscle. Now, think over here that these 2 muscles, teres major, latissimus dorsi, they were coming from where? They were coming from the posterior aspect. That is the region of scapula. So they are part of the posterior wall of the axilla. This P major is coming from where? Let me use a different color. This P major is coming as the anterior wall of axilla. So the anterior wall and the posterior wall, they are actually converging. They are actually converging. They are meeting where? At this intertubercle sulcus. Therefore, this small area over here, only this small area, very small area, hypothetically, it's a part of the bone only this forms the lateral wall of axilla. So lateral wall of axilla is nothing but the intertubercle sulcus. Why? Because both anterior posterior walls are meeting laterally. They are both meeting laterally, as we can see in this image as well. Got the point? So this is where the anterior wall is coming, like this. This is how the anterior wall is coming, and this is where the posterior wall is coming. And both of them are meeting where? Into this intertubercle sulcus over here. So lateral wall by this. So by just looking at this diagram, trying to understand from which position this diagram is taken up, you know the boundaries of it. I hope this point is clear. Actually, this is the most important point. Else, then contents and this can be easily learned. But if you don't have a basic knowledge of which area specifically are we dealing with, then if your base is not strong, then the building will not be strong. I hope you all know that simple thing, right? So in this diagram, we know anterior wall, posterior wall, medial, lateral wall. Then we can proceed further. Why? Because apart from this, we will have an apex and a floor as well. That we'll see later on. So we have this now, come the apex part. This apex, they have started apex and the base over here. Now what is apex and base? Coming back to the original figure over here, or what we have discussed previously, what I said to you in a previous image, that this is the axilla. Imagine this is the axilla on both the sides. This is the region of the neck, and this is the in center, we have the thoracic cavity. Getting a point? On both sides laterally, we have the 2 upper limb over here. And in between all of this, this is the region of axilla. I hope now somewhat it would be clear. You can see the neck is quite thin compared to the trunk. Then the trunk, it enlarges in the width. So the axilla is going laterally like this. Now, if you see this, and you know, okay, sir, as we explained, this is the anterior wall, behind the posterior wall, this is medial wall, that is lateral wall. What is this apex and floor? Now, apex and floor will be, this region obviously is the region of apex. This is the apex. It is connecting the neck to the upper limb. And this region, which is actually our armpit region, this armpit region over here, that is the base or floor. This will be the base or floor. These are only 2, you can say, the boundaries which are left to discuss. Anterior, posterior, medial, lateral, we have done. Apex is connecting neck to the upper limb. Therefore, apex is also known as cervico-axillary canal. Cervico-axillary canal. What is cervico over here? Cervico means cervical, the neck region, cervical vertebrae region. So the apex is connecting the cervical region, neck to the axilla. That is apex at the top. Base is the armpit region. Base is the armpit region. Remember this basic point. So this is apex at the top, both sides. These are the base, anterior wall, posterior wall. Medially, what we can't see, it is the ribs, rib cage, and laterally is this intertubercular sulcus. Okay, now understood this, then we can quickly go and complete the notes over here. Apex, now let me use a highlighter over here. Apex, we have entered the neck, also called as cervico-axillary canal, right? Base, front. Now this is the region of armpit, right? Now in front, what we have the anterior axillary fold, the lateral margin of the pectoralis major. So front we will have the anterior axillary fold, which is formed by the P major muscle. Posteriorly, what we will have the posterior axillary fold, that is by the latissimus dorsi muscle. So you can understand that both the muscles are going like this. So their borders, the lateral borders will form the anterior posterior axillary fold. And medially, we have the lateral aspect that we have. Okay. Then over here, now there's a small typo error. This is not the base. We are discussing the anterior wall over here. We are discussing the anterior wall over here. Okay. Anterior wall by P major minor that we all know. And subclavius also can include. Posterior wall by these muscles, subscapularis, teres major. That will also are all the muscles related to the bone scapula. Anterior posterior wall and this middle lateral wall. Middle wall, again, upper forells and the related structures. Lateral wall in this bicipital groove, it is same as the intertubercular groove. So tendon, the biceps brachia will be there in the bicipital groove, that is intertubercular sulcus. Okay, this was the most important point to understand the axilla. Okay, then we can just add on. We can answer questions like write a short note on the contents of axilla. Yes, this question is quite an important question. Content, I already told you, don't forget nerve, vessels, lymphatics. Now I am repeating this again and again and again. Guys, these three structures over here, which I have written down, these are the backbone of any living tissue. Any living tissue in your body will be requiring the nerves, the vessels, and along with the vessels, you have the lymphatics. We call it as a cardiovascular system. The lymphatic system is a part of the cardiovascular system. Whatever blood is not coming back or whatever content is not coming back through veins comes through lymphatics. So actually lymphatics go along with the vessels. Now these are the lifeline for what I said, any living tissue. You have any living tissue in your body, be it your knee area, ankle area, your trunk, your neck, your face, your hand, any area, and even the fingers, they need nerves and vessels. Yes or no? That obviously. Why nerves? Because nerves to stimulate and vessels to provide nutrition to the living tissue. So therefore, these three will be obviously content of the axilla. And apart from this, I already told you the connective tissue and all the fibrofatty part and all that. Now, this is an image. You don't have to make up this image, but you can understand through this image that this, you can see the ribs over here. Can you see the ribs? So this is forming which wall? This is forming the medial wall. We are looking at the right axilla. This, you can see the upper limb over here, the arm over here. And this whole area over here, now you can, I guess, fairly understand this is the whole axillary region over here. And that is what we are dealing with. And if I just revise, then upper part over here was the region of the apex. This region over here was the base or the floor. And then we have the anterior wall, which I actually removed. Now, in this image, you can see, or you can see that you can't see P major, right? Because anterior wall has been removed. Why? To show you the content of axilla. You have to remove the anterior wall, no? Because it's a image taken from the front. So you have to remove the skin and the anterior wall, and then you are seeing this. After you remove the content, then you will see the posterior wall behind. And laterally, all they are meeting is where the muscles are meeting over here, like you can see the P major, which has been deflected. So this part over here will be the lateral wall of axilla. Okay, I hope the axilla basic idea and the boundaries are clear. Now, contents, you can see artery, vein are the vessels. These are nerves. These are lymph nodes. Apart from lymph nodes, we have the fibrofatty tissue. And yes, in the breast, we talked about the axillary tail of breast. Remember? Mammary gland, we talked about, no? There's the axillary tail. Basically, breast is in front of the chest wall. But a part of it passes through a foramen and enters into axilla. That small part can also be, can also be, but will be considered as part of the axilla. That is axillary tail of breast. If I just recall your knowledge, guys, it was the foramen of Langer. Okay, and axillary tail, if I remember, is tail of Spence. These are all the scientist names. So you can't help with it. You have to read it and learn the names at least. So these are the contents and some few nerves over here, long thoracic intercostal. Why they are written different over here? Now you might argue that, sir, when they have already said cords, and as you said, the cords are the nerves over here. Then why separate these? Because they are not a part of brachial plexus. These nerves, they do go and supply when long thoracic will be a part, but this intercostal brachial mainly. Long thoracic will be a part, but intercostal over here, it actually is coming from T2. It is sensory. We'll understand it later on when we'll discuss the in detail. But yeah, these are nerves only. Don't complicate yourself right now. But remember, these are nerves. Okay, so nerves, vessel, lymphatics. Extra point you can add on is the axillary tail of Spence. That is a part of mammary gland, extension of mammary gland. A small extension, not a very huge, but a small extension. Okay. Okay, that's the content. Now, when we're talking of content, I told you we're discussing two main things. One is the vessel, basically the artery, and one is the nerve, that is the cords. Now, the second point should come to your mind that, sir, so many things are there. Why are we discussing this only? Why not other things? Let us discuss axillary vein in detail. Why we are discussing artery and this cords mainly? I'm saying using the word mainly is because obviously there are a couple of things that they, first of all, they form a huge proportion, huge percentage of the space. And second thing, obviously, I know by now, if you have been following my lectures, and you know, what I keep on saying is that what is important for you as a student of this medical field is whatever you're learning should have some clinical or practical importance. So in this region of axilla, it is these two nerves and vessels, mainly artery, which are clinically important. Which are clinically important. Okay, clinically important meaning by they can be damaged to the nerves, they can be damaged to the artery. The artery can be compressed by many things, by a tumor can be grown over here, a sharp wound can come, someone, any piercing structure can hit the axillary region, that can happen. And in the axillary artery, if there is a damage to the artery, it will lead to severe blood loss in a very short span of time. That doesn't happen in a venous drainage, venous blockage or venous damage. And nerves, obviously, these nerves are controlling the entire upper limb. Suppose the entire upper limb is fine, but there's a small problem in the axilla, in the cords. Upper limb will stop to act. Upper limb will stop to act. It will not move. It will be paralyzed. But it will attain some different posture because the nerves are damaged over there. So therefore, these structures become more important, and therefore they are discussed in detail. So let us come to the axillary artery to begin. So question can come like write a short note on the axillary artery and its relations and its branches. Okay. Now we know where to where axilla is. Now, if I ask you, okay, that do you have a good clear idea of where to where axilla is, and try to answer my question. Try to answer my question that do you have a clear idea of it or not. Think about it. Understand. Now, what do we mean by a clear idea of the extent and boundaries is? By now we have read about all of this boundaries in the beginning. So axilla will start from where? We have an apex at the top, cervical axillary canal. Then what is the lower limit? Lower limit was the border of these muscles. Which muscles? The P major and the T major behind. They are the lower limits. So they form the actual boundaries of this area axilla. And therefore, artery will be only called as axillary artery if it is traveling in the axilla space. The moment this artery crosses, say, for example, the teres major muscle lower border. Now, this artery is not inside the space of axilla. So you can't call it as an axillary artery after it crosses the lower border of teres major. Now, it will have some different name. It is going to the upper limb, arm region. So we'll call it as brachial artery. I get a point. So axillary artery is only axillary artery till it is inside the spaces of the axilla. Now, second question, when can we, sir, so where does it start? As we discussed, okay, that the heart is giving rise to all the vessels, right? And from heart, aorta, and subclavian artery, they will come up. Now, axilla, immediately what was the boundary of axilla was the upper ribs, upper four ribs. So now, as soon as this vessel, which vessel? Subclavian artery. As soon as the subclavian artery crosses the first rib, as soon as it crosses the first rib, now it has entered into which space? Into the axilla. So axillary artery will start at the outer border of the first rib. Now, before that, proximal to it, proximal to the first rib, axillary artery is not axillary artery, it is subclavian artery. The names change. The blood flow will remain the same. There is no change in the blood flow, but the name will change. But the name will change. Try to understand this. So if I try to draw over here, though there will be images later on also, but try to understand. Suppose I try to make the sternum over here. Look very carefully, the sternum, right? And then I'm not drawing the clavicle. I'm drawing only the first rib. This is the, imagine the first rib. Okay. Now let us try to draw the heart, not the heart, but the aorta. This is the arch of aorta that is behind the manubrium. From here comes the brachiocephalic trunk right side, and there you have the right subclavian. So this is the subclavian artery. Which artery? Subclavian artery. Now, till the first rib, or proximal to the first rib, it is subclavian artery without doubt. But as soon as it crosses the first rib, I'm changing the color a bit. This is now which artery? This will be the axillary artery. So this is your axillary artery, and this over here is subclavian artery. Now, if I try to show you one more thing, what is that? Okay, this is the muscle lower border of teres major coming from the scapula lateral border and going where into the medial lip of bicipital groove. This is your, let me just try to show you the teres major muscle. Let me label it also. Imagine this is the teres major muscle. So now this was the axillary artery traveling the axilla, but as soon as it crosses the teres major, let me change the color back to the red. Now it is not axillary artery, it is now brachial artery. Right? So axillary artery is only axillary artery till it is inside the boundaries that we have discussed till now. This is axillary artery. So let us come to the notes. Excuse me. So begins at the outer border of the first rib as a continuation of subclavian artery. I hope it is now clear. And ends by becoming brachial artery at the lower border of teres major. Point clear? Now this is a statement you can use with cram also, but that won't be much beneficial for your long-term knowledge. Therefore, I explained. Axillary artery is divided into three parts by P minor. Now, what is this thing? What is this new thing coming up? Let us understand this. Now, when they are saying axillary artery is divided into three parts by P minor muscle, now you have to imagine that here you have a bone that is the scapula, and this is the, imagine the coracoid process of scapula. Coracoid, I'm writing scapula. What actually happens is, guys, that here you have the ribs. Let me draw the ribs also. Say a third rib over here, a fourth rib, and a fifth rib. These are ribs number third, fourth, and fifth. Why I'm drawing third, fourth, fifth? Because here the muscle comes. That muscle is which muscle? This purple color muscle is. This is your your P minor, pectoralis minor. If you remember our previous discussion, P minor coming from the third, fourth, fifth rib, right? Or coming from the coracoid process of scapula going into third, fourth, fifth rib. So what happens? This P minor is covering that axillary artery. And this is how we can divide the axillary artery into part number one, that is above P minor, part number two behind P minor, and part number three below P minor. Take time to digest, try to understand. First, we have delineated the entire extent of axillary artery. Then we have placed a muscle in front of axillary artery, that is P minor. Why in front? Because P minor is the anterior wall of axilla. It is not the posterior, it is anterior wall. It will come in front. Now, suppose this span over here is the axillary artery from your side, guys, and I place a muscle like this. Okay, then this will become artery part number one. Part number two is behind my fingers. Part number three is over here. Simple as that. So axillary artery is divided into three parts by the P minor muscle. Point clear? There will be more diagrams for you to understand. First part superior to the muscle, second are posterior, third part inferior to the muscle. See, branches and all can be easily learned. I'll tell you the trick also, but this basic thing you have to understand a bit in the beginning. This is the image over here. Now let us try to delineate some of the names over here. See, this over here is the artery. You can imagine, you can not imagine, but you can see the axillary artery over here. And this is the muscle P minor. This is muscle P minor. You can see it is coming from rib number 3, 4, and 5. And it is covering the artery in front. And therefore, artery will have parts like what? Part number 1 over here, part number 2, and part number 3. 3 parts. Before the first rib, this is known as what? Subclavian artery. Okay. And after the teres major, this is known as what? Brachial artery. And between this, it is known as axillary artery, as labeled P minor over here. The muscle in front. This whole muscle is P minor. Right? It is outside the rib cage. Okay. Now let us see the branches. Branches not that difficult. The relations can just read them once. Then you learn to write them. Not that difficult, but yeah, read them once. Now branches axillary artery. How to name the branches? Now another simpler diagram. Branch is very simple. Let me just, yeah, there's an empty space. Let me just try to quote over here. Now, branches of axillary artery. I'll just tell you how to remember them, and things will become very easy. Okay. So let me just try to draw the axillary artery. This is, imagine the axillary artery. And let me just name it part number 1, part number 2, part number 3. And here you have the muscle that is P minor muscle. First part will have a 1 branch. Second part will have 2 branches. and third part will have 3 branches. First of all, this should be clear. Total there are 6 major branches. Got it? Okay. Now you can understand that which part is higher up, first, second, or third. You say obviously the first part is higher up, third part is lower down, second is in middle. Correct. So therefore, the first part over here will give a branch that is known as superior thoracic artery. Which artery is superior thoracic? But it is lying in the superior part of thoracic region. The second part will have 2 branches, right? One of them is known as thoracoacromial trunk. Thoracoacromial trunk. And second branch is lateral thoracic artery. Lateral thoracic artery. Now, as the name suggests, lateral thoracic artery will run down laterally in the thorax. This will be obviously the lateral thoracic artery. And then we have the small trunk known as thoracoacromial trunk. This is the thoracoacromial trunk. Now, we haven't used the word artery over here. This is trunk. When there is a branch coming out from a major artery, and when that branch will immediately divide into other branches, then that branch is not known as branch, it is known as trunk, because it is still quite a big artery, and its length will be small. Are you getting a point? The trunk, that is the thoracoacromial trunk over here, its own length will be very small, few millimeters or maybe 1 centimeter, like that, not much. But then it will be spread out into different branches. And how to remember their name? There's a trick over here, a small trick I may share with you. Thoracoacromial trunk will divide into 4 branches, and they are known as APCD. Mnemonic is APCD, not ABCD, APCD. Notice APCD again, so it's complicated. There's no complication over here. Remember the regions. Now, where is second part? Second part, this is my clavicle over here. This is roughly area of my coracoid process. So this will be my P minor, deep to P major. So this area is somewhat over here. I have the thoracoacromial trunk coming, and it will be going to supply this whole area. Mnemonic is APCD. Now, what is A over here? A is the acromial trunk. A is the, sorry, not trunk, acromial branch. Now we will discuss branches. Acromial. P is the pectoral branches. Pectoral region, obviously. C is the clavicular branches, because clavicle is also just in front. And D is the deltoid branches. Deltoid, this whole muscle is deltoid only, overlapping. APCD. The second part gives of 2 branches. One is thoracoacromial trunk, which will give of ABCD, and second is lateral thoracic. Now, if you guys have revised, and I'm sure some of you should be doing it, our previous session topic was breast mammary gland. In it, we have discussed this artery. It is one of the major supply of the breast tissue or mammary gland in females. Okay, look at the blood supply of mammary gland. You will again recall this artery, and you can understand it is running laterally lateral thoracic. So it will supply the lateral quadrants of the breast. Common sense. Then you have the third part. Third part is having 3 branches. These 3 branches over here, one of them is subscapular artery, and other 2 are anterior and posterior circumflex humeral artery. Don't worry, then the notes also we have the names. Now the third part is where, in comparison to first and second part, this is, imagine the third part, it is lower down. It is lower down and laterally. Laterally, what we had, if I may use another, laterally what we had over here, the head of humerus. So laterally we had the whole bone of the upper limb, or the bone of the arm, humerus. So this third part over here will give off branches that will go around the humerus. They are known as circumflex humeral artery. And one is subscapular. Now, why are we using subscapular? Because, as I said, that I'm writing over here, the third part of AA's axillary artery is inferior and lateral to first and second part. So when we are saying, and when you're seeing the diagram, that is inferior, so it is supplying the lower part of the scapula. So the nerve, the branch is subscapular, not suprascapular. Get a point? Try to understand. Because after a few days, you might start to forgetting the name of subscapular You might say, sir, it was some scapular, I don't know, sub or suprascapular, which is scapular. Oh, I'm so worried, I'm so tense. Then this concept comes into play. You may take a few seconds while answering in your Viva OC, but then things will come into place. It is subscapular because this third part is quite below. So we can't call it a suprascapular. And then you have anteposterior circumflex humeral branches. These are the total 6 branches. How many branches? Total 6 branches of the axillary artery. One branch from first part, 2 branches from second part, and 3 branches from third part. Okay. Now, this information we can see in the form of notes over here. Okay, let me highlight the branches. You can see the superior thoracic branch. You can see thoracoacromial trunk over here, and lateral thoracic, second part. Third part will have subscapular and anterior circumflex humeral and posterior circumflex humeral. Let me write down the name of the part. So third part, second, first, and second. I hope the point is clear. Which branch is coming from which part? Right? Okay. Now, the same thing is being shown with the help of mnemonics and other notes over here. Mnemonic for branches. Here is another mnemonic. You can use that also. Mnemonic for all the branches are sometimes life seems a pain. Sometimes life seems a pain. Yeah, I mean, that is the truth and that is how life goes. So no need to worry. Sometimes life seems a pain. I hope it is not right at this particular time. For some of you, it can be, but yeah, this is a mnemonic. Sometimes life seems a pain. Superior thoracic, thoraco-lateral, subscapular, anteposterior circulation. Okay, remember these 6 branches, they are frequently asked. Okay. Okay, so the name of the branches is what, this is how this is, guys, I'm just going through, but this is all we have discussed. This is how you should answer in your theory, right? This is how you should answer. In a tabular form, it looks nice. And then a short note on the axillary vein, was artery vein. It's formed by the union of couple of veins. It's formed by the union of basilic vein and a vena comitatus of the brachial artery. What is basilic vein? Again, we'll come to the upper limb. And then there are 2 veins, superficial veins, which are basilic and cephalic vein. More medial is the basilic vein, more medial. These are superficial veins. Let me write over here. These are which veins? Superficial veins. So more medially superficial is basilic vein. And vena comitatus, brachial artery is deep. So what actually happens, guys, understand, and this you will see in your dissections also, is once you reach an artery, like a brachial artery in a dissection, and you are very happy and you are calling your friends and your table teacher that, sir and madam, see, I have found this brachial artery, how, that gives a sense of satisfaction, no? That you have been dissecting for half an hour, now you've seen something and seen some structure, it is a different joy, right? Arteries are not red in color, they will appear like white in color and a bit elastic. But for the beginning, when you're looking at an artery, it won't be appear total white like an artery. Why? Because it will be surrounded by small veins which will be appearing dark blue in color, and these are the ones which are known as vena comitatus. So the axillary vein is formed by a combination of the basilic vein and these small veins which are surrounding the brachial artery. They form the axillary vein. Tributaries, there are a couple of tributaries over here. Cephalic vein also, it actually drains into the axillary vein. Remember, that is also a question asked in MCQs. So do remember this couple of lines. This might help you. Write a short note on axillary lymph nodes, guys. This we have discussed already while discussing the topic of breast or mammary gland. And again, it is very important. Why? Because all the carcinomas, so see a breast that most of it most of it metastasizes through the lymphatic route only, through this axillary lymph nodes. Okay, this we have discussed anterior posterior group, lateral group, central apical. Again, tabular form, you can just go through it and you can slide it, right? So a couple of applied anatomy, palpation of axillary lymph node is a clinical examination. When we look of CA breast, fair enough, we already have discussed. Axillary abscess, they can be abscess in the axilla. They can be abscess anywhere in the body. So axillary abscess, where to drain it anatomically? So it is drained by given incision in the floor. Where was floor? Floor was the region of the armpit region. So we know that where to incise. Because this axilla is a huge region, no? You can't be cutting everywhere. Midway, where exactly in the armpit region? Midway between the anterior posterior axillary fold to avoid injury to main vessels, anterior posterior laterals. So you know that, okay, if there's an abscess, how diagnose an abscess? There's a, let me tell you, clinical point of view, there is a small nagging pain from several days. Then there is some restriction of movement of the upper limb, then there's associated fever of the patient. And this abscess actually inside, so you can't see it on the outside. That's also a problem for the doctor to diagnose. But then you go for some scans, like even an ultrasound scan, you might see an abscess, or patient might give you history, okay, that there was some penetrating thorn or penetrating injury which happened to me 15 days back. So certainly abscess will not come into play suddenly. It will take some time. It will take few days. Then there will be fever, and you take a blood report of CBC. You might find an elevated total leukocyte count. Normally is 4 to 11,000, and 15, 20,000. Even there is some infection going on. You have to diagnose where exactly it is. Then you give antibiotics, and if you find out, then you have to drain it. Because for an abscess inside, you have to drain it, else it will keep on accumulating, and obviously harmful for the body. So you should know where to incise to drain the abscess, because this will be the most dependent part, heavy part. By gravity also, put an incision over here and drain the abscess. Okay, so this is also important. Okay, let us now come to the brachial plexus. Okay, brachial plexus, a nerve part over here. So let us discuss the brachial plexus first of all, and then we will come to its various notes part over here. Guys, very, very important topic is the brachial plexus. Okay, so be with me for the next 10 minutes. I will give you a very good picture to understand the brachial plexus. We'll start from the beginning. We'll start from the entire beginning, and then we'll go into the details and notes part. But be with me for the next 10-15 minutes to have a good idea of the, or a good solid basic conceptual idea of the brachial plexus. Right? Okay. Now we'll start from the more basic picture. This brachial plexus is the plexus of nerves. Now, what are these nerves going to do? They are going to supply the upper limb. In which way? They are going to give the motor supply. They are going to give the sensory supply as well. Point clear? Clear. Now, these nerves are coming from where? Now, these nerves are coming from the spinal cord. That is, these are the spinal nerves. Clear? Clear. Spinal nerves. Which spinal nerves? Basically, they are coming from the C5, C6, C7, C8, and T. Most of the times it is C5 to T1. But in brackets, I'm writing C4 can be seen. In that case, brachial plexus is known as prefixed, or T2 can be seen, in which case it is known as postfixed brachial plexus. But yeah, it is C5 to T1. Just remember this C5 to T1 at least. Now, if you know or you have read the general anatomy a bit in detail, you know that when the spinal nerves come out, they rapidly divide into two rami. One is the thicker one going anteriorly, and that is known as the ventral rami. Which rami? Ventral rami. And this is imagine the spinal nerve. One that is going behind, that is an thinner, that is the dorsal rami. Always remember the dorsal rami only innervate a small region of the back. That's it. That's it. A small region on the back that is only innervated by the dorsal rami. So the entire body except that area is supplied by ventral rami. So when anyone says C5 to T1, you, for technical purpose, you should know that it is the ventral rami of C5 to T1, which is forming the brachial plexus. So now we have started to come out from the vertebral, the cervical vertebrae. Nerves are coming out. They are C5 to T1. So they will come out like this. No? There's C5, there's C6, there's C7, there is C8 and T1. And your upper limb is over here. Upper limb is over here. And this is, imagine you have these spinal cord over here. You have the spinal cord over here. I hope you are with me. This is say C5. Let me write C6, C7, C8, and T1. Now, what happens is, why we study brachial plexus so much in detail is that from its journey of from the spinal cord to the upper limb, obviously it is going to pass through a very important area, that is the axilla. There are various permutations and combinations. After that, it goes and reaches supply the upper limb. It doesn't go directly like this. Why are there so many of permutation combinations? The reason is because each nerve supplies different areas. Now, there is not a nerve. So each spinal nerve, or each, we can say, a specific spinal nerve segment like C5. C5 will be contributed to many nerves like median nerve, ulnar nerve, radial nerve, all that. And similarly, median nerve, ulnar nerve, radial nerve will have other spinal segments. So it is a game of permutation and combinations. Don't have to dwell into details of it. I'm not teaching you the 12th class maths over here. Understand this. There's a lot of intercombinations that we have to understand. And for that, again, the mnemonics will help. So for the brachial plexus or the nerves to reach from a spinal cord to upper limb through axilla, there are various combinations. And that can be remembered by a mnemonic. Let me write the mnemonic at the top over here. Mnemonic for you to remember is right to drink chilled beer. Okay, here I'm not promoting any product, just for the mnemonic purpose I'm telling you over here. So don't take it otherwise, or don't take it literally seriously. So it is right to drink chilled beer. So we have R, we have T, we have D, we have C, and we have V over here. This is the thing that you to understand these 4-5 names. Right to drink chilled beer. I'm writing over here R, then we have T, then we have D, then we have C, and then we have V over here. What is this? R is the roots over here, or the rami over here. That is R. So R is already done. Now T stands for the trunks. All these 5 roots will form trunks. How many trunks? 3 trunks will be there. Each trunk will divide into various divisions. Each trunk into not various, only 2 divisions. A ventral dorsal division. So each trunk will have 2 divisions, so total 6 divisions. And these 6 divisions, they will have their own permutation combination. They will form C for chords. How many chords? 3 chords. And then this chord is going to give off main B for branches. That is going to supply the actual upper limb over here. By actual, I mean arm and forearm and hand region. That is right to drink chilled beer. First, we have roots. So this is already the roots over here. These roots will form the trunks. 3 trunks are, let me write the names, upper trunk, middle trunk, and lower trunk. Each of the trunk will form 2 divisions, a ventral and a dorsal division. So 3 into 2 is 6. And 6 divisions will form 3 chords. The name of 3 chords, let me change the color a bit. The name of 3 chords will be a lateral chord, a medial chord, and a posterior chord. There will be 3 chords. And then these 3 chords are going to give so many branches. It does not mean that only chords will give branches. But do remember, I'm writing in a small box over here, that chords are obviously going to give branches. But the roots and trunks will also have branches. Roots and trunks will also have, divisions won't have any branches. You have to remember at least two branches of root and trunk. So 2 branches of root, 2 branches of trunk. Then there's going to be branches from chord. Okay. I repeat, for the spinal nerve to reach the upper limb, it has to pass through axilla and it has to do some permutation combination. The reason also I told you again, each segment is going to join many nerves, and each nerve is being formed by various segments, by which we have a specific dermatome and myotome for the upper limb and any part of the body. This is our gross anatomy. If this concept is not clear, go to the nervous segment or nervous system part of the gross anatomy. Or just read it this part only, you will understand this. I hope. I mean, this is the basic concept, why we have so permutation combination. So we have root, trunk, division, chord, and branches. And out of this, remember, the chords over here, let me write, the chords over here are the ones which are actually lying in the axilla. It is the chord only that is actually lying in the axilla, not the root or trunk or division. No, root, trunk, division, they don't lie in the axilla. It is a chord that lies in the axilla. The root is obviously close to the neck. Then obviously just later to it, you have the trunk part. Then suddenly trunk divides divisions. Mainly once you dissect the axilla, once you open it up, whatever nerves you are seeing, they are basically chords or obviously their branches. This is what you see in the region of axilla. Okay. That's the basic concept wise. I hope this point is somewhat clear. Then we can have a look at the notes and try to understand what the notes is trying to tell us, and then things will be clear. Okay. A plexus of nerves, so write a short on brachial plexus can be question. Plexus of nerves found on the anterior rami, that is the ventral rami of the C5 to T1. Fine. Okay. Let us see in this image over here. Right to drink chilled chords and their branches. All these are branches. Chords and branches. This is the mnemonic that you can apply over here. So roots are C5 to T1. And you have 3 trunks over here, upper trunk, middle trunk, and lower trunk. Then each trunk you can see is dividing into six divisions, two divisions, so total six divisions, ventral, dorsal, and there these divisions they form the chords that you'll understand. Okay, I'll make another way for you. Just look at this table first of all. Then I'll show you how the chords are formed after this particular flowchart. So roots located in the neck because they're coming out of the vertebral column. Trunks again in the neck region because suddenly after roots, trunk will be formed. So it is not that trunks are in the axilla, no. Then after that, divisions are formed. Trunks are divided into divisions. Trunks divisions are behind the clavicle. Okay. So here you can see that how the three trunks are formed. Upper trunk by C5, C6. Middle trunk by only C7. And lower trunk by C8, T1. So we have C5, C6. They form the upper trunk. C7 forms the middle trunk, and C8 and T1 they forms the lower trunk or inferior trunk. Each trunk is divided into antepost divisions. Now divisions are where? Behind the clavicle. And divisions don't have branches. Root and trunk will have at least couple branches. Do remember it. Chords are the ones which are found in the axilla. Here you can see chords, they are lying in the axilla. How are chords formed? And so lateral chord, medial chord, and posterior chord. So if I ask you how many divisions were there, there were six divisions. Right? Three trunks and six divisions. So lateral chord is formed by the anterior division of upper and middle trunk. Then lower trunk anterior division forms the middle chord, and all the three trunks posterior division they form the posterior chord. Don't worry, we'll make it a diagram and then we'll try to explain to you again. So let us come back to our discussion how these are formed. I'll go from this side, this time I'll go from left to right side. So we have C5, C6, C7, C8, and T1. Okay, these are the R for roots. C5, C6 combined, which trunk? Upper trunk. So we are discussing trunk over here. C7 straight away, middle trunk. C8, T1, which trunk? Lower trunk. Okay. Now let us see their divisions. Each trunk into two divisions. So we'll just use a bit of color coding over here. So let us use this color for the ventral division. Okay. So here we are writing the divisions. Upper trunk, middle trunk, and lower trunk. Fine. This is the ventral division of upper trunk. This is the ventral division of middle trunk. And this is the ventral division of the lower trunk. We'll write it. What we are drawing, we'll write, don't worry. This is ventral division VD, ventral division VD, and ventral division VD. Now three more divisions. That is a dorsal division. Let us see that also. I'm using different color altogether. This is the dorsal division of upper trunk, dorsal division of middle trunk, and dorsal division of lower trunk. These are all DD, dorsal division. Total, how many divisions are there? Six divisions. Trunks, three trunks. Now see how the chords are formed. Let us now come to the final part, that is the chord. So we are now discussing CORDS chords. Because they are clinically more important. Why? Because they are lying in the axilla. Chords again, three will be there. So what actually happens over here? Now I will use three different colors. Start the black over here. You can see the ventral division of upper trunk, ventral division of middle trunk. They will combine. They are going to form the lateral chord. Black color, lateral chord. Clear? Okay. Green color. You can see the ventral division of the lower trunk. That is going to form the medial chord. Which chord? Medial chord. Fine. And then last not the least, you can see all the dorsal divisions, they are forming one common chord over here, which is which chord? That is your lastly posterior chord. These are the three chords. Now, again, I am going to repeat. The ventral division of upper trunk and middle trunk. Keep on looking at the diagram. The ventral division of upper and middle trunk, they form the lateral chord. Then the ventral division of the lower trunk will form the medial chord. Medial. And the dorsal division of all these three all these three trunks, the dorsal division of all of these three, they are going to form the posterior chord. Then this is going to form a lot of branches. But now, and the question should come to your mind, sir, we are using the word ventral, posterior, medial, all that, lateral, medial. They are in relation to what? In relation to each other? How are we going to judge? Suppose I keep my three fingers over here. These are three chords. Which is lateral, which is medial, which is more posterior? Isn't that a bit difficult? It can be. So they are named. The chords are named. The chords are named. How? The chords are named according to their relation to another structure. Which structure it can be? See, when we are discussing the region of axilla or chords or brachial plexus, it is not only the nerves, there are vessels also. So right at the axilla, there is axillary artery going, which we have just discussed. So what actually happens is that you have the axillary artery. Suppose I'm making a second part of axillary artery. Which part? Second part of axillary artery. This is the point. So chords are named according to relation with the second part of axillary artery. I'll show you how. Now imagine over here that this black, not this black, but this dark blue color, this cord is lying behind the axillary artery. This dot mean it is lying behind. This was a posterior cord because this posterior cord is lying behind the axillary artery. Which part? Second part. Lateral cord, black color. This will be the lateral cord over here. So lateral cord will be lying over here. It is lying lateral to the axillary artery. And medial cord, the green color is lying more medially, over. This will be the medial cord. So we have named the chords according to their relation with the second part of axillary artery. Okay. And then there are obviously going to be lots and a lot of branches. Don't worry about the names. I'll tell you the mnemonics. And then let me write the mnemonics here itself. That while discussing the notes, we are good to go. Lateral cord will have 3 branches. Mnemonic is LML. LML, I don't know how many of guys you've been quite young. I don't know whether you have seen it's an automobile brand in India, LML. Normally scooters used to come. A couple of decades back, they had some motorcycles also. I can't recall exact names of motorcycles, but they were. So LML, you can just search. Middle cord, the mnemonic is M4U. M4U. M4U is 4 times M and 1 U. Posterior cord mnemonic is ulnar. ULNAR. That is the mnemonic of posterior cord branches. Then there are 2 branches on root, 2 branches on trunk also. They have 2 branches more. Okay. That will see what are all the branches. This is the whole idea of the brachial plexus. Let us come to notes now and just let us go through what we have discussed till now. Okay. So this is how the chords and all are found. Fine. Now here's an image, similar image that you have seen, but only this time it is from right to left side. So we have roots. You can see the trunks, upper, middle, lower, superior, middle, inferior, same thing. So 3 trunks are there, and each trunk has 2 divisions, total 6 divisions. 3 chords are there, lateral, medial, posterior. And you can see the 5 other branches are shown. Not only 5, but these are the main 5, or you can say the 5 terminal branches. But they are, I told you the mnemonic. Lateral will have what? LML. Posterior will have the mnemonic ulnar. And middle will have M4. Total, you can see that 5, 5, 10, 13 branches are there from 3 chords. How many branches? 13 branches. But yeah, there are 5 terminal branches also, which are also important. You should know that these are the main 5 branches: axillary, median, radial, ulnar, and musculocutaneous. But in totality, there are 13 branches coming from the 3 chords, and 2 branches from root and trunk also. That also we will see. Okay. So now the name of the branches over here, these are all the branches, and I will be highlighting them for you guys. From the root, 2 branches, remember, nerve to long thoracic nerve or nerve to serratus anterior. That is branch number 1. Second is dorsoscapular nerve or nerve to rhomboids. So there are 2 branches from root. 2 branches from trunk. Now, which trunk can be asked? So it is mainly or only from the upper trunk that we have 2 branches: suprascapular nerve and nerve to subclavius. 2 from root, 2 from trunk. Which trunk? Upper trunk. So middle and lower trunk, they don't give any branches. Then what after root and trunks? From division. Divisions have no branches. I'm writing it again over here. Divisions will have no branches. Well, guys, there was once an MCQ. Entry was which portion of which part of the brachial plexus has no branches. The root trunk division chord 4 option. Answer was division. And if you have not understood this thing, no, normally as a layman, anyone will think division itself means branches. So why will there be no branches? You may think in that way also. No? So do remember, division itself has no branch. Okay. So no branch. So we'll actually come to the chords, and chords here you can see little chord. What mnemonic I told you, LML. So you can see L and then M L. This is LML or LLM also. If you are fond of the lawyers, you can remember LLM also. depending LML or LLM. Middle chord was I said the mnemonic was M4U. Let me first write the mnemonic over here. LML, M4U, and ulnar or ultra. You can ulnar also and ultra also. Ulnar, that is this T or N, right? Only one letter difference over here. So M4U is one M, second M, third M, fourth M. Just go through them, and last we have a U over here. Then ultra you have upper subscapular, lower subscapular. If you are using ultra, then it is thoracodorsal, axillary radial. If you are saying ulnar, then it will be nerve to latissimus dorsal. Go through these names, must know names. These branches, 13 from the cords, 2 from the roots and trunks. Go through them. Okay, we have the applied aspect also, movements and all, and applied aspect also of Klumpke's palsy. I would give you as a homework, guys, to read them. Then in the next session, I'll give you a glimpse of these two palsy. These are the two palsy or two clinical conditions when there is damage to the brachial plexus or cords of brachial plexus. Okay, or basically brachial. These are the problems of the brachial plexus. Could be in the root and trunk also. But do remember this. It's a homework for you to remember these two questions do come from here also, much more important. But this session, I wanted you guys to actually have a good, concrete, solid knowledge of the axilla as a region. Then axillary artery, how to remember their branches. Then a good, solid, basic conceptual idea of brachial plexus. Okay, then you can add on to this knowledge in the form of palsies, right? So guys, that's all from my side. And okay, let me show you the MCQs again if we can see it. Just a second, guys. Okay, poll over here. Okay, I'll share some questions to you. I'm not sure if you are able to see it or not. Okay, but we'll discuss some questions, or I will read out the questions for you, and you can just try to answer them, or just actually to listen or answer them in your head also. That also will come into play. So first couple of questions is we already did is that. So what was first question? Yeah, spinal roots contribute to the which spinal roots contribute to the brachial plexus? That was C5 to T1. Then brachial plexus divided into which 5 regions? So remember the mnemonic: right to trunk chill beer, root trunk division, cords and branches. Okay. And another question over here: which nerve arises from the posterior cord of brachial plexus? So that you can only answer if you know all the branches. So mnemonic I discussed, that was ultra or ulnar. So they're asking which nerve arises from the posterior cord. So ulnar nerve, median, axillary, musculocutaneous. So ulnar nerve, guys, know it. Ulnar nerve was actually from M4U, middle cord. In ultra, we have upper and lower subscapular, nerve to latissimus dorsi or thoracodorsal, and you have radial axillary. So in these options, C option axillary, that would be our answer. Then fourth question is injury to the upper trunk of brachial plexus leads. So that you will also learn in your the homework which I gave you. That will be our basically ups palsy. Okay, which of the this question you can try to answer. Which of the following is the boundary of the axilla? Okay, the options over here are option number A, that is pectoralis major. Option number B, that is teres major. Option number C, deltoid. Option number 4 is biceps brachia. So which of the following is the boundary of axilla, or let me specify it, which of the following is the anterior boundary of axilla? So in that case, it will be the pectoralis major, right? So in this way, you can practice the topics, and then we can discuss more of the questions from this particular part, right? Okay, so that's all, guys. I hope you enjoyed. Any other questions, any other queries, do ask in the comment box. And see you soon. And remember the homework, the strength Klumpke's pencil. Okay, that's all. Bye bye. Good night, and happy Diwali once more.